Hello, my name is Victoria. I'm part of the MSc Psychological Therapies team. We are made up of psychotherapists, counsellors and psychologists. We know from experience that the emotional and psychological impact of a cancer can start from the initial tests and investigations through diagnosis, treatment and remains with us for some time after. Our role is to work alongside our clinical colleagues, providing support with the emotional and psychological impact of a cancer diagnosis. The aim of this video is to share what people have told us about the emotional impact of cancer and give you a brief snapshot of some of the tools that can be used to help manage this. The impact of a diagnosis affects the individual and their family and their friends. Patients have shared with us common thoughts and themes. These include that diagnosis can feel like a tsunami of destruction. Patients tell us that they feel left surveying the devastation and wondering where and if they can start rebuilding. People also talk about a tidal wave of emotion. It comes out of nowhere, 1 minute fine and the next devastation. A diagnosis of cancer is life-changing. It is big and it is powerful, so we should expect our emotional response to this to be equally intense. We may feel we want to push these emotions away, possibly even feel pressure to be composed and be strong, but sometimes that can feel lonely. Some have spoken about a feeling of being in a bubble. They can't reach out, connect or engage. You might want to pause this video and consider do any of these resonate with you. Patients tell us they feel as though no one can reach in and you can't reach out. I don't want to lose my independence and freedom. You no longer have the same perspective as other people. Your life has changed and their life hasn't. Cancer is the exclusive club that no one wants to join. I just want someone to listen to me, not to tell me what they think I should do. I feel like I can't talk to my family or friends. This last statement is often a concern that individuals have. Although friends and family are very supportive, when you are feeling low, they are the last people you want to upset. This is where talking therapy can be helpful, because it is a safe space to express all of it. At the end of this video, we will tell you about the range of support which is available should you want to talk to someone outside of your family. For now, we will focus on sharing a few simple ideas we know have helped our clients. Self-care and thought management. Self-care is an often overused word, and we can sometimes find ourselves raising our eyebrows at the suggestion that a bit of self-care will solve it all. We define self-care as intentionally taking time out to invest in and manage our overall well-being. We are taking positive action to preserve or improve our health and well-being. The first step, and often the hardest, is to prioritise yourself and your needs. This applies to patients, carers and their families. Prioritising our self-care can be hard as we live in a society where exhaustion and fatigue is seen as a badge of honour. It may be particularly hard for those individuals who have responsibility for caring for others, be it family members, at work, or simply part of how we value and define ourselves. What helps many of us reflect on this lack of self-priority is to think of the oxygen mask principle. If you've had the privilege of being on an aeroplane, you will be familiar with the flight attendant talking through the safety procedures. They will tell you that if the oxygen mask drops down, you need to place your own mask on before helping others. The reason for this is simple. If you do not have enough oxygen, you will pass out and be unable to help anyone else. Self-care is as important as this. You are no use to anyone else if you are no longer looking after yourself. This is often a real struggle when juggling a cancer diagnosis with all your usual responsibilities. Taking time to attend to our own needs can strengthen our resilience and leaving us feeling a little bit more able to cope with what else is going on in our lives. It can help to think of your capacity for coping with all that is going on as a battery. Picture your smartphone. If you only had 10% battery, you may save that battery for emergency calls. You may avoid using your apps or browsing on the internet. If you're at 90%, you may happily have a look on social media, for extended periods of time even, or join in a group chat. We're the same. When our battery is low, we need to make choices about how we expend our energy. We can also give thought to what and who can help top up our battery. The most important thing about self-care is that you make time to consider what works and what doesn't for you and actually do it. Next, we're going to look at thought management. One of the exercises we use regularly with our clients is STOP. STOP, S-T-O-P-P, stands for stop, take a breath, observe, perspective, practice. We can use this at any time we are feeling anxious or overwhelmed. The first step is simply to stop. Pause in what you are doing. Take a few calming breaths, breathing in through your nose and out through your mouth, consciously slowing your breath down. This serves to calm our nervous system and re-engage the thinking part of our brains. Next, observe. What thoughts are going on through your mind? Where is your attention focused? What are you reacting to? What's happening in your body? Perspective. Here we work on considering alternative thoughts to balance our concerns and worries. We may ask ourselves, what is another way at looking at this situation? Am I considering all the options available to me, or have I got stuck on one? For example, am I stuck on what if it goes wrong? Have I given space to balance that thought with, or what if it all goes right? Consider, are the thoughts you are having facts, or are they internal opinions that can be challenged? The final step is to practice regularly. The more we practice, the more effective it is when we need to use it. It sounds simple, almost too simple, yet our clients tell us it does work and it has been useful for them. If you find that this was useful, we also offer mindfulness. If you are interested in finding out more on mindfulness, you can visit our page to find other examples of mindful exercises which you may find useful. We also offer a mindfulness course for patients with a diagnosis of cancer. If you're interested in this, you can ask your clinician to refer you. We hope that you have found our video useful. Should you wish to explore talking therapies further, our psychological therapies teams are based in Basildon, Broomfield and Southend. The services offered include psychological therapies, mindfulness, anxiety management training and other workshops. The services available may be slightly different based on where you live. If you would like to find out more, you can speak with your cancer nurse specialist, CNS, or your consultant. If you're a family member or carer, you can still ask to be referred, or you can call our main switchboard numbers, found on the MSE websites, and ask them to put you through to the counselling teams, Basildon or Southend, or psychological therapies team at Broomfield.